Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Daniel Grace of Hamilton Internal Medicine Clinic near the corner of Broderick and Burleson Drive in Dalton, Georgia. Thank you for joining us, Dr. Grace.
It's great to be here.
Dr. Grace is a board-certified internal medicine physician and the Associate Program Director of Outpatient Medicine at a new physician practice called Hamilton Internal Medicine Clinic. Dr. Grace, how long have you been with Hamilton?
Well, I just started with Hamilton in July of this year, so July 2020. I'm coming from the University of Missouri in Columbia, Missouri. But actually, I went to medical school at Mercer University in Atlanta and did most of my community medicine rotations over a 4-year period in this community. So I got to know a lot of the local community physicians. I actually worked with a physician who's now one of the physicians at Hamilton. So great learning, great educational opportunity. Got to know the community quite well during that time.
Well, that is fantastic. So you know our community already.
Somewhat, yeah. Definitely over the last couple of years, part of that assessment, we did a community needs assessment during that time, and it was very illuminating in terms of how we could best meet the needs in Dalton and Whitfield County and the surrounding areas.
Oh, that's wonderful. That is great. It's so good to have you in North Georgia.
Well, thank you very much.
That is fantastic. When it comes to spare time, and I've been talking with doctors now for a few weeks, and it seems like you guys and gals don't have a lot of spare time, but when it comes to spare time, what do you like to do when you're away from medicine, away from the office, away from patients?
Sure. So I have 3 kids, so...
Oh, really? Wow. Well, I know what you keep busy with then.
Yeah, definitely. They're 8, 5, and 3. I got to make sure I get all the ages right.
Wow.
So I am quite busy at home taking care of them. We recently purchased a kind of a fixer-upper home. Have loved being there, but, we spend a lot of time getting things together, getting the house back to ship shape.
Right.
So
a family of 5, that is wonderful.
Mm-hmm, definitely. But that's where I spend most of my time. We spend a lot of time outdoors. My wife is an outdoor enthusiast and a cyclist and a hiker and a runner, so we do those things with our kids quite a bit.
Now, you have boys, girls, combination?
All boys.
All boys.
Mm-hmm.
All boys. Well, that is wonderful. You are going to love that, and they're going to love this area.
Mm-hmm.
They're going to absolutely love this area. Why did you choose to become an internal medicine physician?
So it's actually an interesting story. So I was actually originally an ophthalmology resident at the University of North Carolina, and during my first year, I actually suffered a heart attack.
You suffered a heart attack?
Yes, sir.
Wow, really?
At
Very
age 30.
young. You were
Mm-hmm.
30 years old.
Yep, 30 years old at the time. Completely out of the blue, was on a mountain bike going up a steep hill. Had some chest pressure, and then went to the doctor 2 weeks later and ended up having a heart cath and a stent that afternoon.
What about that at 30 years old? And you are in great shape. You look to be in fantastic shape. Now, see, I've had a heart attack.
Oh, wow.
I had a heart attack when I was 49. I'm 56 now. And I had a 5-way bypass.
Oh, my goodness.
And since then, I've had a stent. I had a stent about 3 months ago. And this was back in 2013. It was a life-changing event for me, and I suspect that you're going to say the same.
Absolutely. I mean, after that, I was started my ophthalmology portion of my program and just felt like I should go into primary care. The primary care physician is the one who really picked up on my issue, got me a stress test, which led to the heart cath and the stent placement at such a young age, even though it wasn't typical. And that person was an internal medicine physician.
No.
So it really impressed me and just helped me to understand the true importance of good primary care.
I understand. That is quite a story. Have you ever figured out what caused this heart attack at such a young age?
The only thing that ever came up was, maybe stress of the long hours and years of study and working hard and
then climbing that big hill just kind of did it, I guess. What about that? At 30 years old. Well, that is a great story. I'm glad that you're a heart attack survivor. So you have heart disease.
Mm-hmm.
You have heart disease. Well, what about that? That gives me a whole lot to think about, and I want to ask you some questions about internal medicine. How does internal medicine compare with family medicine?
Yeah, so the two specialties are quite different. As you know, that there are 4 different really primary care specialties, and I explain it to my patients like this. Pediatrics mainly focuses on kids. Family medicine will see anywhere from, sometimes even involved in childbirth up to 90 plus. Internal medicine is kind of the adult counterpart to pediatrics. It's really kind of a misnomer. I think probably adult medicine would be a better term for the specialty, but internal medicine is what it is. Practically, in our training, internal medicine, we spend a lot more time taking care of elderly, sicker patients. We rotate through the ICU. We spend time with cardiologists and kidney specialists and lung specialists, whereas the family medicine tends to rotate more broadly. They'll spend time with obstetrics, gynecologists, general surgery. They just don't spend as much dedicated time to those sicker patient populations. Pediatrics, spends most of their time focusing on children. Typically, again, the sicker children who have multiple either developmental issues or, even healthy kids, focusing on vaccination schedules and just normal development. And then gynecologists also are considered primary care. And usually, they of course follow women through the pregnancy and childbirth, but also can provide routine health screening, well woman exams, things like that. And usually their patients are healthier females who don't have a compendium of medical issues ongoing.
Right, I understand. So you can think of this as pediatrics for adults. So this is like adult medicine.
Absolutely.
Internal medicine. That is very interesting. Very good. I'm so glad that you're with us today on Health for Life. In fact, we need to take a break here on Health for Life, and we will be right back.
Caring like a family, fighting like an army. Hamilton Healthcare System is here for you. Armed with a love for our community, advanced care, and personalized service, our commitment to serve with compassion stands strong in this season of uncertainty. You are the heart of all we do. Visit us at hamiltonhealth.com for timely health information and updates. Take the following everyday steps to help avoid the spread of COVID-19 and other respiratory viruses. Wash your hands often with soap and water for at least 20 seconds. Cover your cough or sneeze with a tissue. Throw the tissue away and then wash your hands. Avoid touching your eyes, nose, and mouth. Clean and disinfect frequently touched objects or surfaces such as remote controls and doorknobs. Stay at least 6 feet from other people and stay home if you're sick. Call your doctor if you develop a fever, cough, or difficulty breathing. For more information, visit hamiltonhealth.com or cdc.gov. Did you know that colon cancer claims over 50,000 lives each year? The good news is that colonoscopies save lives. Convenient appointments are available at Hamilton Medical Center's new Bandy Endoscopy Center, located at the corner of Broderick and Memorial Drives. Hamilton follows CDC guidelines and screens for COVID-19 symptoms at the door. If you are age 50 or older or have a family history of colon cancer, ask your primary care provider to schedule your colonoscopy. Please don't delay important medical screenings. Your health won't wait. If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you.
Welcome back to Health for Life. We're talking with Dr. Daniel Grace of Hamilton Internal Medicine. Dr. Grace, who should see an internal medicine physician?
Yeah, certainly. So we we see a broad range of patients. We see healthy 18-year-olds who are just there for their annual exam, need a flu shot, cough, cold, sore throat, runny nose. Typically what we specialize in are taking care of those older patients, or even like yourself and myself have younger, who have multiple medical problems such as hypertension, diabetes, cholesterol issues, asthma, COPD. Typically what we do is coordinate a lot of specialty input. So if someone is seeing a kidney specialist and an orthopedist and a cardiologist, will look at all the recommendations from those specialists and kind of form a cohesive plan, putting all that information and recommendations together to make what we believe and what the patient's best interest way forward from that time. So typically we see those folks who have more medical problems, and that, reflects our training, having experience with those patients who are a little bit sicker or in the hospital more often.
When you talk about, you see a patient who has like many medical problems. I've got a diabetes doctor. I've got a cardiologist. So I would be maybe a patient that would come see you.
Absolutely. Mm-hmm.
And you kind of tie everything together.
Yeah, absolutely.
Tell us about Hamilton Internal Medicine Clinic. How is it different than other physician practices?
Sure. So Hamilton Internal Medicine Clinic is actually a resident-run clinic. So resident physicians see the patients. They're the primary caregivers, and then they coordinate the care with the supervising attending physician, such as myself or one of the other doctors in the clinic there. So that's how it's different.
So it is much different. And now you're talking about residents. Mm-hmm. And our next segment is coming up in just a few minutes, and I want to talk about residents and what that exactly means.
Sure, absolutely.
Yeah, we can talk about that in just a moment. We're going to take a quick break. We'll be back shortly. Health for Life. Thank you for listening. Dr. Daniel Grace is our guest, and we'll be right back. Don't go away.
Caring like a family, fighting like an army. Hamilton Healthcare System is here for you. Armed with a love for our community, advanced care, and personalized service, our commitment to serve with compassion stands strong in this season of uncertainty. You are the heart of all we do. Visit us at hamiltonhealth.com for timely health information and updates.
You're on Health for Life with Dr. Daniel Grace. Thank you for listening. Dr. Daniel Grace of the Hamilton Internal Medicine. And a few minutes ago, you were talking about resident physicians. What is a resident physician, and are they a doctor?
Absolutely. So every resident physician is a physician. They've completed 4 years of medical school, gone through all of that training, and graduated. So they are medical doctors. Mm-hmm. Most physicians at that point do elect to continue further specialty training, such as in internal medicine or pediatrics or surgery. So the second set of training, or residency, is what provides the specialty care. Basically, it teaches a surgeon to be a surgeon, an internist to be an internist, or a family physician to be a family physician.
Okay.
So that is actually where we get a lot of our hands-on training.
Is in residency.
Is in residency. That's
and that's
correct.
What you're doing now.
And that's what we're doing now. Generally speaking, the first year of residency is called the internship. That's when residents spend most of their time in the hospital. And then the second and third year, they actually spend a good amount of time instructing the first-year residents and continuing through their subspecialty rotations, selecting what area of internal medicine, whether they want to be a hospitalist or a primary care physician, or even if they want to go on and do further training, such as a pulmonologist or lung specialist, or heart doctor or cardiologist, or a diabetes doctor, like an endocrinologist, during that process. And it helps them to get the experience they would need to make a good decision about what they want to do, by giving them kind of a broad smattering of experiences with other physicians, if you will.
Now, is that what you're doing right now?
Right. So what I'm doing, my job currently is to supervise residents in the outpatient clinic. So I'm over that primary care portion of internal medicine residency. Our residency program director, Dr. Deidre Pierce, is over the whole program. And then we have kind of two divisions within our program. We have the hospitalist part, which is seen by Dr. Baines, and then the outpatient or primary care part, which is overseen by myself, and that's a good portion, a third of the experience is actually in that clinic, in the primary care setting, so that, to make sure that the residents have a good breadth of experience of what they're actually going to do in a day-to-day primary care physician life.
Wow. Very interesting. And how many residents do you have there?
Currently, we have 18. So that number will gradually increase to 36 over the next 2 years. So in residency training, there are 3 years of training. Each year is going to have 12 residents. So as we slowly build up, as you know, we opened last year, we were actually able to select 6 second-year residents who transferred in from...
That's how you got your 18 number.
That's correct. And then we had 12 first-year residents who matched into our program. So the match is actually an interesting way that's done as well. So we had 2,700 applicants for 12 positions.
2,700?
That's correct. It's incredible.
That is incredible. How in the world would you pick 12 out of 2,700?
Well, it's a difficult process.
Did you have a part in picking those?
Well, I wasn't here in the system yet, but this upcoming year I will.
I wonder if you'll have that many try again.
Oh, I'm sure we will. It's a very good program, and so, you know, what we've seen so far, we're very encouraged by the number of applicants that will be coming in. But basically, we use a smattering of different criteria to try to pick the top 200 or 300.
Right.
And then last year, 200 to 300 live interviews actually at Hamilton Medical Center over a period of several months. And then after that point in time, the hospital will rank the top number of residents from 1 to 300, whoever they interviewed. Mm-hmm. And then the individual applicants will rank their programs for 1 to however many programs they interviewed. And then a giant computer at the graduate medical education office matches these names and hospital systems together in a giant ceremony called Match Day. It's a big celebration for medical students because they find out where they're going to go to residency. And, you know, some programs don't even fill all of their positions. But like I said, we were very fortunate to have a large number of applicants well qualified. We're very happy with how things turned out. The residents are great physicians. They're very eager to learn and have done a good job in the few months they've been here.
Well, it sounds like they worked very hard for that position. You say, I'm sorry, tell me again, 1,200? How many?
2,700.
2,700. So you had 2,700 people going after 12 positions.
That's correct.
Wow, that is something else. And you'll be a part of choosing those next year.
Yes. And
that is going to be a huge job going through that and picking 300 out of that, 2,700. Wow. So it sounds like that you picked the cream of the crop. Or we got some great residents.
Yeah, we were very fortunate. Like I said, most of the residents are very well trained, coming from all across the country, in various different programs. Most of our second-year residents were physicians in other countries, practiced for years, completed their training, and wanted to come to the United States. So actually have to go through residency a second time in the United States. So they actually have a great amount of experience and have been attending physicians in other countries as well. Mm-hmm. So they bring a lot of maturity and clinical experience to our program, which is very good in the leadership roles that they currently are serving. So
Hamilton is a teaching hospital.
Correct. That's absolutely right. So we have the residency program. We also host a large number of medical students. Those come from a couple different sources. The Medical College of Georgia being one of the main contributors, and then we also have the Philadelphia College of Osteopathic Medicine, which is in Atlanta, that sends us students as well. And those students will rotate in our clinic as well, work with the residents. The residents will have opportunities to be not only learners but educators, which is just as important to training, is to learn how to teach people well as it is to learn the information yourself, because that's what they're going to be doing with patients.
Well, that's true. And then you said after first year, a lot of the second and third year residents will help those that are just coming in the program. Yeah. And then when you get these doctors from other countries that have to go through the residency program, that is just wonderful.
Mm-hmm. It is, because they bring so much in terms of just breadth of experience. So some of them have actually been physicians longer than I have. So.
Really?
Yeah, it's incredible.
That is incredible. That is great. It's so interesting, the residency program, teaching hospital, all this. I'm learning so much today. I'm glad that you're with us. Folks, hold on. We'll be back in just a moment on Health for Life after this with Dr. Daniel Grace.
If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you. Did you know that colon cancer claims over 50,000 lives each year? The good news is that colonoscopies save lives. Convenient appointments are available at Hamilton Medical Center's new Bandy Endoscopy Center, located at the corner of Broderick and Memorial Drives. Hamilton follows CDC guidelines and screens for COVID-19 symptoms at the door. If you are age 50 or older or have a family history of colon cancer, ask your primary care provider to schedule your colonoscopy. Please don't delay important medical screenings. Your health won't wait.
Welcome back to Health for Life. We're talking with Dr. Daniel Grace of Hamilton Internal Medicine. So many great things we've talked about so far in this 30-minute program. We're about to wrap it up here in just a few, but I do have a couple of other things that I wanted to talk to you about, Dr. Grace. First, tell us about Hamilton Internal Medicine Clinic. What kind of services do you provide at the clinic?
So absolutely, we work on doing a lot of preventative health, so things like cancer screenings, immunizations, trying to keep people healthy in the community, not just treat the disease, but also be proactive and keep people from getting sick to begin with. We do our Medicare wellness checks, Medicare wellness exams, annual physicals. But we also spend a lot of time taking care of patients' chronic medical problems. And as you know, our community continues to age just as it does across the whole country. That's going to be much more important to be able to coordinate care among multiple chronic medical conditions with multiple specialists. In addition, we do spend a lot of time doing coordination of care with patients who've been in the hospital, who've been seen in the emergency room or urgent care. So we actually have a resident team in the hospital who admits patients and takes care of patients directly. Mm-hmm. They're there all the time, every day, day and night, taking care of those patients. And so a lot of the time, just like with any community, making sure that things that are supposed to be done in the hospital and are set up actually get performed once they're back home.
I see. So after they're after they go home from the hospital and they get home, you guys still work with them and help them.
Absolutely. And a lot of times, if somebody has an orthopedic issue or a heart issue or diabetes issue, they're given, sometimes 2 or 3 referrals to specialists that may be started on 3 or 4 different medications and have a complex home regimen. When they come to the outpatient clinic, we're reviewing all that information, making sure that they were able to schedule those appointments, helping them when they're not being able to, sometimes contacting those physician offices directly, and then reviewing all the information that was done in the hospital, if there were any outstanding blood work that needed to be done, or follow-up CT scans or x-rays, making sure those things get performed. Basically coordinating that into one package so that the patient's care is appropriately carried through that entire time. And, studies have shown, and, personal experience, the better job we do of doing that, the less likely patients are to end up back in the hospital, either from heart failure or COPD, or even just medication complications. Sometimes, we want to do the best by everyone and do no harm, but sometimes, if there's an adverse reaction to a medication and we can catch that early, it'll prevent bad things happening down the road. So, getting that early appointment for a hospital follow-up or emergency room follow-up can be quite preventative and stave off a lot of issues down the road.
Yeah, I would imagine so. And you say you have 12 physicians there now, resident physicians.
Well, we have 18.
You have 18, okay.
Yeah.
So you have 18. So you guys can talk amongst yourselves, get second opinions on a patient, and really make a difference.
Yeah, absolutely. So, like I was saying in a previous segment, the residents see the patient as their primary caregiver, just like any community physician. The residents are in the residency program for 3 years. Many of those may stay on even later in the community, but during those 3 years, the resident will see the patient just like any physician would. And then they will come and present their information, their findings to myself or Dr. Masson, who's another physician in the clinic, or Dr. Pierce, the residency program director. Sometimes we'll actually present that information in the room with the patient so that they feel involved in that process. And when we do that, it actually gives another set of eyes to go over everything. And I know you probably feel the same, that, when you have somebody else looking over your work, they can always pick on something that you didn't see the first time.
Every single time, yes.
So it's really helpful to have that second set of eyes looking over all the information. Personally, I when I write something, I always get someone to proofread it. So, it's kind of like that. While these residents are still in their specialty training, even though they're full physicians, we give them feedback, input, help to make sure that all the typical preventative care measures are met and that we're doing what's right for the patient. So in that, time and time again, we can just find that fewer things are missed. Things are reviewed further than they would be if it was just one person at a time.
I understand. One of the things that, because the weather is really changing, and it seems like this year is changing quick, flu shots. And flu shots are very important.
Absolutely. That falls into that preventative care and immunizations that I was mentioning earlier. We will be doing that for folks who want to come by to the clinic and get a flu shot, establish care with a new primary care doctor, and make sure all the other preventative stuff is up to date as well. Good.
That's good news. So go in, get your flu shot. That's a great idea, and you'll be on your way. What about insurance? You got self-paid, you have insurance. Y'all take a lot of different insurance, I'm sure.
Absolutely. We operate just like any other primary care clinic in the community. We take self-pay patients. We take Medicaid, Medicare, private insurance. So anyone who comes to the clinic is going to get service. We'll even work with folks who are on the needs-based program as well.
Good. That is very good. It's wonderful. And I know that right now in our community, there's a need for more internal medicine doctors. And so it's great having you guys there.
Absolutely. As our community gets older and, there are more complex patients, the older in life and the longer in life that we go, internal medicine physicians are just going to be incredibly important in keeping this whole cohort of folks healthy, long into life, preventing things as long as we can, so that that the years that are there are not just years, but they're enjoyable time as well.
Dr. Grace, it was great having you as a guest today.
Thank you so much for letting me come on the show.
I'm glad you did. Thank you for joining us for Health for Life today. Had Dr. Daniel Grace on the air. A very interesting interview. If you'd like to have more information or for an appointment at Hamilton Internal Medicine Clinic, call this number, 706-226-8990, 706-226-8990, or visit hamiltonhealth.com/internal. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.